Hello everyone, welcome or welcome back to my YouTube channel. I'm Samantha Taberam, a graduate BCN nurse, and I'm excited to share with you my nursing internship experience. So if you're curious about what an internship nursing experience is like, this is the video for you. I'll be talking about the requirements needed, my experiences, challenges, and valuable lessons learned. So let's dive right in. Internship is basically you working for 1 year as an intern nurse after finishing or graduating. So this is mandatory for all Ugandan medical students. So if you're doing medicine, if you're doing nursing, if you're doing midwifery, pharmacy, dental surgery, you are going to be required to do internship for 1 year. And what are the requirements? I'm going to tell you according to my experience because requirements may keep on changing. So for us, we paid 50,000 shillings for the temporary license. We had 4 passport photos, all our academic documents and their photocopies, a national ID. And when you finish all that, because you take it to the council and then they verify it if it's right, they give you a form to fill in. And this form, you leave it there. I think this is when you are applying for your internship or telling them that, hey, I'm ready for internship. So you fill in a form, leave it there. So after filling in the form and leaving it at the council, of course, they'll tell you that you have to wait, depending, maybe a month or two. If there is another cohort of interns doing internship, you have to wait for them to finish. So for example, for us, we are finishing on the 31st of July 2024. So the next cohort of interns may begin in August. So you have to wait until the other cohort finishes. But as you wait, there are specific facilities that are used for placement or internship. For example, these are normally government-owned hospitals or facilities. I'm talking about Mulago Hospital, Chirudu, Kawempe, Lira Regional Referral Hospital, Jinja, Masaka, Gulu. As long as the government owns the hospital, it's more likely that you're going to be placed there. And then there are also some private not-for-profit hospitals. I'm talking about Nsambia Hospital, Lubaga, Mengo, Lacho. They are private hospitals but are also used for placement. So don't be surprised if you're put in one of those hospitals. They are also used. You have to keep in mind that you're not going to be put in a facility that you would want to work in. For example, people who are in Kampala want to remain in Kampala. So you want to be put in Mulago, you want to put in Kawempe, Chirudu, in Zambia, those hospitals, Naguru, but you find yourself that you have been taken to Lira, you've been taken to Gulu. Here, you can swap. They allow swapping. So you can get a person with the same profession with you, a person who is willing to swap, but you should have strong reasons why you want to swap. Because you don't just wake up in the morning and you say, I don't want this place, I want another place. You have to have strong reasons because you have to come with this person. You go to the ministry, right, and give your reasons why you want to swap, and you're allowed to swap. But unfortunately, in my cohort, we were not allowed to swap because of the striking, of the suing, and all that. So we weren't allowed to swap. We had to go to the placements that we were given. But also keep in mind that they also allow change of location after 6 months. So, for example, this is done if, let me say, the hospital that you are put maybe doesn't have a surgery department, and maybe your major is in surgery, you are allowed to swap to another place. If maybe they don't have a pediatric department, you're allowed to swap in another place. So this is normally allowed after 6 months. Let me take you through the payments and salaries. This is very, very tricky because the president said that we have to earn half of our seniors' salary. So I was expecting around 2.4 million every month, but unfortunately, we are being paid 1 million across the board. So nurses, midwives, doctors, pharmacists, everyone is getting 1 million across the board. And the amounts keep on changing. Every cohort had a different amount of money that they earned. And the first cohort, people years ago can tell you for them they earned around 700. The other people, 2 years, 3 back, people can tell for them they were earning around 2.7, 1.7, depending on how hard you strike. But now strikes are no longer helping. Strike or not, you're going to be paid your 1 million. So, and I've also been hearing about them saying that they want to remove the allowances. They're ridiculously so low already, and I do not know why people want to remove them because these are very, very helpful to us. Imagine you're being uprooted from Kampala, you're being taken to the north, no allowance or anything. How do you expect me to survive? there is transportation, there is feeding, there is accommodation. How do you expect me to survive? So I do not think this should be removed in any way. And I'm also hearing they want to introduce exams, interviews before doing internship. So if you're being paid your 1 million per now, take it. Now, when it comes to my experience, I want to take you from the very, very beginning where I found out that where I had been accepted to the internship. I remember the list came out, which was around 11 p.m. something. I'm closing, kind of closing to midnight. I was awake. I was in my bed on WhatsApp, and my friend texted me this list. It had my name on, and she had underlined it in a red marker, and she was telling me, "Welcome to Lyra." I was like, "No, I'm not going anywhere." I switched off my phone, turned off the internet, went to sleep. I was like, "I can't go to Lyra." So the next day in the morning, I opened my phone. It was a list of messages from so many people telling me that, "Samantha, you're being placed to Lyra," and some were telling me, "How are you going to survive?" So I remember I told my mom I've been placed in Lyra, and she told me, "Okay, that's okay." And I was like, "I can't go to Lyra. I do not know anyone there." And on top of that, my friends were giving me the things of, "You're going into a war zone, you're going into a refugee camp. There is nothing like internet there, there is nothing like network there. You know what Kanye did?" And please don't blame me. I had never been to the north. I didn't know anything about it. So we had and I had this information from my friends, and on top of that, the TV never serves us the right information. If you've noticed, when you're watching TV, they're always showing you kids are dying, people are very, very poor, nothing is good in the north. So I did have this good picture about it to myself. I was like, "God, am I going to survive?" They told me, "When you reach Karuma Dam, and you cross it like this, the your service is going to be off. You will not be able to contact us. Just get ready to be running every day because you're going to be just in a war zone." I told my mother, "I can't go to the earth. I can't go to the north." My mom told me, "Samantha, what do you want? Do you want to do internship? You've been waiting for internship for a very, very long time. Do you want to do internship?" I said, "Yeah, but I can't do it in the north." So she told me, "You can swap." I went to the ministry, and I thank God that I'd already had 4 people. One from Lira himself, he wanted to swap. They had given him in Kawempe, so he wanted to swap from Kawempe to Lira. And I had another one in Masaka. I had another one in Naguru. I had a good number of options. So I was like, okay, we went to the ministry. I chose the one in Lyra because he wanted Lyra, and he had given me good reasons. Like, I'd written his Casmo, like, help me out. So I was like, "Okay, I'm going to swap with you." And we went to the ministry. To hit it in our face, they were not allowing swapping. And then they were like, "If you do not report within a week, we shall know that you're not interested in doing what? Internships, scrap your name off." So I had to come back home, tell my mom, "You know what, I'm going to Lira." My mom was like, "It's a nice place, I've been there." I was like, "No, they have told me so many things." I had so many bad things that had been told to me that I didn't even look at the positive side. But I remember my mom tried also trying to help me with the swapping thing. And I think God just had plans for me. And I remember packing my suitcase that day crying, crying, and went to YY bus terminal, booked my ticket, and set off. And another thing is, my mom was calling me every after an hour to check on me when I was in that bus. And it was even increasing my anxiety because I was like, if she's over calling me, that means the place I am going to is not safe. So it was increasing my anxiety. On top of that, my friends were also checking up on me. So it was increasing my anxiety. And I remember I reached Karuma, and I was checking my phones. I was checking my phones to see if I still had service, if my Airtel was still on, if my MTN was still on, my Leica was still on. So I was checking my phones. And when I crossed and they were still on, I was so surprised. So I started saying, "But these people had told me that I was not going to have any service." So that's when I was like, "Okay, Samantha, we are into this. Let us do this. We are here for 1 year. Let's do this." But in the back of my mind, I always had the thing of, if the opportunity comes and I want to change, I will always what? I'll always change. So I reached the hospital, and upon reaching the hospital, it was nothing that I expected because my expectations were way down, 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 down below. And I didn't expect anything like good or anything. So for me, the electricity, the safe place, the safe water, the place to sleep, the people, it was all like reassuring from God because I had told God that I do not want to struggle. I want everything to be easy for me. I do not want to feel like I'm changing or anything. I just want everything to be easy for me. And for me, when I reached there and everything was easy for me, it was reassuring from God that, hey, my child, I got you. Like, I got you. I got you. Everything is going to be fine for you. So that is the time that even God brought me Stella. I remember I was seated there. I think I was waiting for their offices to open. I had reached like around 7 and no office had opened yet, and I was just seated with a frowned face. And I was like, I just can't wait to leave this place. And she was moving, I think, with another person. So she was like, hello, good morning, how are you? Have you come for internship? She introduced herself. I was like, yes, I've come for internship. And that is when she was like, oh, that is good. So where are you from? I was like, I'm from Kampala. Then she was like, have you booked for a bed or a room? They have an intern mess. I didn't even know about that. So she took me under her wing, like she took care of me. Even right now, even during internship, like she's the kind of person who is checking up on me. Samantha, have you done this? Samantha, we're supposed to do this. Don't do this. No, these are the places to go. These are the places to avoid. Like I'm not being aware of my country. Like I had to just take in whatever people give me. But if now you look at my vlogs, I am making the most of what the North has given me. I am moving to Arrow Falls. I went to Nyeta Hill. Like I'm moving around my country, and it's something that people should try so that they can avoid the thing of hearsay. I had this, I had this, I had that. After that, we met for orientation. They met the director, the senior nursing officer, and the internship coordinator, and they told us the do's and don'ts of the hospital and do's and the don'ts of the internship, what they expect from us and our expectations. And that is where they give you your contracts. You sign your contracts there and then. And after that, we were thrown into the den. I mean that word. You start working. So they give you 1 week for reporting. And after that 1 week, the next week, you go straight to work. That's how it began. So if I can talk about the uniforms, every hospital has its own rules and regulations. I was so fortunate that where I was placed, they allowed scrubs as long as it could identify you like, hey, I'm an intern nurse, I'm an intern doctor, I'm an intern pharmacist. That is it for them. So we used to put on scrubs, and I would say that scrubs are the way to go. They're easier to move in, they're more comfortable. Like I'm not every time curious about, hey, am I okay? Am I okay? No. Because I have had some hospitals are so strict with the white dress, white cape, white that. But especially us women, we have those times. So as a woman, am I going to be looking behind all the time to check if I'm okay, if I've not got a stain or something? Like I feel like the dress code then for Nightingale was suitable for her and it was appropriate for her. But I think as medicine keeps on evolving, we should evolve with it. We shouldn't stay in analog when people are moving in digital. So I think hospitals should keep this in mind as they're making uniforms. I've seen a lot of hospitals are embracing scrubs. There is nothing wrong with them as long as someone is identified, as long as someone can, because your uniform is not the one providing the skills, it is the person providing the skills. So the person should just be presentable enough, and that is it. When it comes to working on ward, you should expect to work alone most of the times as an intern. When they tell us that you'll be supervised by your seniors, it's rarely there. So you expect to work alone. You expect to manage your patients with your intern doctor. You expect to manage your ward alone. You expect to be the teacher because they are nursing students coming in from other nursing schools around. So expect to teach, expect to manage the ward, expect to manage your patients alone. So here you have to remember to have your skills intact. You have to be knowledgeable. You have to be confident. You have to be a critical thinker. because no one, okay, it's okay to ask for help, but when I'm going to be honest with you, when the staff in the hospital see that an intern has come, for them it's like, oh, the intern has come, we can now go to these places. They now remember the programs. I can now go to the market, I can now travel to here, I can now go see who and who and who, because the intern is there. So most cases, remember that you're going to work alone. On the positive side is that you're going to get hands-on experience, which is going to improve your clinical skills, give you more confidence, because when you are alone, it's different when you are a team. When you are a team, I can always say, I can't manage to do this. What do you think about this? But here, yeah, when you're alone, you will do what you said you will not be able to do. So I think that's the only positive side. I got hands-on experience. There are some things I did and I was like, "Ooh, did I do that?" But then at the end of the day, you're saving a person's life, and that's what is most important. Also, as you're working on those words, keep in mind that there is also going to be assessment. Now, in the orientation, they gave us two, I don't know if it's across all hospitals, but where I was placed in Lira, they gave us two options. So you have two majors and one minor. Now, for example, a nurse, you have medicine, surgery, pediatrics, obs and gyn. You choose. Major, you can choose medicine and surgery, and your minor, you can choose obs and gyn. So, in your major, you're going to do 5 months. Minor, you're going to do 1 month, and your other major, you're going to do 5 months. And after every major, you're going to be assessed. So you have to keep in mind that as you're working on these words, let your supervisors see you, because they're the ones going to assess you. You're also entitled to a leave of 1 month throughout your internship. So remember, I told you that you're going to work for 11 months. That means you have one extra month which is given to you as a leave. And you are, I don't know if it's how other hospitals do it, but we spray it out through our internship. So you can spray it out into a 1 week, or you spray it out into a 2 week. So you can work maybe after your major and take a leave of 2 weeks, come back. So depending on how you're spraying it out, you're entitled to a leave of 1 month. Then there is also salary. Salary is the most important thing, because money is a motivator to do so many things. I'm not going to lie. And they pay us in quotas. So quotas, what I mean is you may receive 3 million depending on how the money is available. Overall, the place that I was given was actually the place for me. Was the place that God said, Samantha, you will thrive here. Is the place God said that, Samantha, this will not make you suffer in any way. It is the place that God chose for me. And what I can say is, just leave everything else and let God make your decisions. It is the most peaceful thing in this life to do. Because right now, as I look back, I feel like Lyra was the place for me. It was the place for me, and I just thank God for it. But I had some challenges. I was first put in IMED, internal medicine. I must say that internal medicine was my best department in this internship. Not only because of the people that I met, they were amazing people. Up to today, I still talk to them. Like, we just vibed. I don't know, but also the staff that I worked with. There were few. I only worked, I think, with two or three, or two nurses, I think. And they were very, very good people. I can go back to the ward even when I was allocated to obs and they would still welcome me like I was still working there. And that is because I used to work. That's because I used to work. But the challenges I had in IMED was the shortage, the staff shortage. Imagine there were 30 patients, and there were only one nurse or two nurses on the whole ward. You think that this nurse, by the time she reaches the 11th or the 10th, even the 5th, you think she's going to still be smiling and happy the way she was with the first patient? That is not possible. So the shortage was real. I don't know if it's across all government hospitals, but I think the government should look into that, because the high patient ratio to nurses was just not fair at all. There was also a language barrier. They were speaking, you people, no one should deceive you that everyone knows English in Uganda. That is not possible. Those guys knew their language, Langi, and English as the second language. So you would have issues. If a person did not know English, you had to find a way of speaking Langi. I learnt a few words, but it wasn't a language that I was so frequent in that I would speak. So, but the good thing, we had like student nurses who would like help us like interpret, to tell them what you wanted to tell them. And this became so important, especially when you wanted to give health educations. Because what I also noticed in internal medicine, there was a lot of sickle cell. It is so rampant. It's a lot. I do not know if these people are not sensitized. I do not know if they do not know about it, but it was too much. I think I'm tempted to make a video about sickle cell, maybe in the near future, because I remember I talked to a mother and I told her, "Do you know what sickle cell means?" And she didn't have a clue about it. And I told her, "Did you test with your husband before marriage?" She didn't have a clue about it. And people should not wait until they are marrying someone or until the wedding is being planned to start testing for sickle cell. I think I'm also going to make a video about which medical compatibility things you should consider before saying yes to someone. Because now a person with sickle cell, I mean, if you know that the person has sickle cell, why are you even saying yes to them? You're going to have kids that are going to be sick. You're going to look after sicklers, and that is when you're going to be tired of everything in this world, because it's so much pain seeing your child in pain all the time. People who have sicklers know what I'm talking about. So I think I'm going to make a video about sickle. So then there was a lot of liver cirrhosis. People in the north can drink. I think because it's also connected to the poverty. They are so poor. The jobs are not there. The women are the ones working. The men drink. Oh my God, the men drink. There's a lot of liver cirrhosis. There was meningitis. But the major problem that I saw there was sickle cell anemia. And I think sensitization is very, very important. If only we could get people who could talk to these people, tell them what they should do to prevent this, I think it would. To me, I feel like health education, preventive measures are better than when someone has got something, especially diabetes. Why would, if a person comes in and the person is a pre-diabetic, why wouldn't you health educate them about a balanced diet? Then a person going back, they do not know what to do, and they come back and the sugar levels are through the roof. So to me, sensitization is very, very important. And if only we could do that, I feel like the sickle cell problem would slightly go down. But then also, teaching these people was hard. Someone told me, "Now you want me to leave my husband? You want me to leave my marriage?" And I was like, "It is the only way that you're going to have healthy babies, healthy children." And she looked at me and she was like, "I can't leave my husband." Also in Africa, they bring up girls, telling them that marriage is up there. If you get a husband, you're so lucky. So when these medical issues come, the girl even cannot leave her husband because she fears that who is going to marry her then. But it was a big problem in the north, and I feel like I don't want to stop talking about it. I'll make a video about it. So after internal medicine, I was put in obs and gyne. It was my minor. I must say this was a great learning experience, as I love bringing life to this world. Assisting mothers have their kids is a beautiful thing. Seeing the mother's face when we give them the baby is a beautiful thing, and also the relief after the pushing, the screaming, and all that I saw it. And it's not that I'm new to obs and gyne. It's just that, when you're working somewhere else for a long period of time, you tend to forget the skills in another department. And we are not blaming anyone about it, but I must say that obs and gyne was a beautiful experience. I worked with midwives mostly there because I was in the labor suite. So I worked with midwives mostly there, and these midwives, I worked with enrolled midwives, those are certificate midwives. They're so knowledgeable. They're so knowledgeable. They know what they are doing. And I learned so many new things that I did not know. I don't have a lot of interest into midwifery, but I love assisting women give birth. I love helping someone have their baby. So to me, if I can do that the whole day, I have no problem. I have no problem with it. The only challenge I faced was, of course, communication. But we learned. We learned a few basic stuff that took us through that world. And another thing is hygiene. Women, when you're pregnant, it does not mean you have to abandon your personal hygiene. Shower, shave, change clothes. That's the least you can do for yourself. We need to shower. That's all I can say. We need to shower. We need to keep ourselves clean. Personal hygiene should not be thrown out of the window because you're pregnant. we need to look after ourselves and our babies, because now you're looking after also another person. So you need to look after yourself and the baby. Surgical department was not new to me because I was already working somewhere in a specialized surgical clinic. So I wasn't so blank when it came to the surgery department. I knew what to do. I knew how to manage pain. I knew what to look out for in wound care. I knew how to detect if there were any sepsis, any infection. So I knew basically what to do. And here, the problem I had was again high patient ratio to nurses. Patients were so many, especially you would look at a ward where there were 40 patients and you're one nurse. One nurse. You people, one nurse and students maybe. But remember, these students are not allowed to do anything without your supervision. So you had to make sure that you had to look into whatever every student is doing. And that is maybe when you have 2 to 3 students or four, and you're moving from this place to that. And the words were so long. Oh my God, governments build these words and they're huge. They're huge. But I remember I was exhausted, especially male surgical ward. It's super, super big. And I think the problem is men wait to come to the hospitals when they can no longer get out of bed. They are very, very sick. I think that's also another problem I had in the male medicine ward. Male surgical ward was bigger because men were the ones getting accidents. Men were the ones that were having serious septic wounds. Men were the ones having all issues. And it was hectic. From head injuries to just septic wounds to traumas to TBIs, like it was just a mess. And I remember I used to go back to the ward and I would just drop. Like I would just drop. Like I was so, so exhausted because you had to come in the morning and triad first. Look through your patients. Who are the sick ones? Separate them. Do infection prevention. Just so you have to separate them. The ones for head injury alone, the ones with clean wounds alone, the one with septic wounds alone. And you had to do wound dressing. After doing wound dressing for almost all the patients on ward, that you have to also, as you're doing wound dressing, you're making sure that you're detecting if these patients have any problems. Have they got any infection in the wounds? Are the wounds septic? Are they clean? What are you using to? Some are using iodine, some are using honey. So depending on which type of wound that you're actually handling. Then there was also limited resources. Most of these people are poor. They can't afford to buy things for themselves. So sometimes you're forced to get into your pocket to buy for someone, especially when it's pain management. I can't sit there and watch a kid cry in pain and maybe I have 5,000 or 10,000. Like, it's just me, it's just my heart. And there was that emotional attachment that we normally have, and we are not allowed to have it. But you find yourself when this patient has been on a ward for a long period of time, you end up being attached to them. And it hurts. You people, it hurts, especially if this patient doesn't survive. It really, really hurts. You you live with these patients. You come in the morning, see this patient, talk to this patient, care for this patient, health educate this patient, do what you can for this patient. You leave the ward, but you live with this patient. Of course, you physically leave the patient on ward, but when you leave, I mean everything. Think about the patient. How are they doing? How they are, and all that stuff. You sleep thinking about if the patient is going to survive, and if you left them in a critical condition, you're going to have. I remember I used to pray for my patients. I still pray for some, but I pray for my patients. I was in female surgical ward, and there was this critically ill patient, and I remember I worked 7 nights, guys. This is another challenge. It's the long duty, the long shifts. I worked for 7 nights. I'm going to incorporate the story into this because the patient comes into this. I worked for 7 nights. And by the fourth night, I did not know what I was doing. I used to sleep. I would just sit on my bed or sit in a chair and I'm knocked out. Like I'm sleepy. I'm done. So I used to wonder, why would a person work for 7 nights straight? It's not normal. It's not, it is not like, I don't know how to call it, but it's just bizarre. Like, how can you let someone work for 7 nights? I remember my roommate would say, "Oh, Samantha," and I like we would start a conversation and I would not know how I slept off. Yes, they're going to give you 7 days after, but it's not healthy for someone to work 7 nights straight. So in those 7 nights, this is when I met this lady. She was in a female surgical ward and she was so sick. I remember that time when I came for duty, she was crying of pain. They didn't, they, I think the father didn't have money. So I was like, it's night. Let me go and look for a painkiller. I remember I moved ward to ward asking for painkiller at night. And I was fortunate enough to get a painkiller. I came back, I gave it to her. I think she slept for around an hour. She woke up. She was crying still. And this time she was saying, I'm tired. I'm tired. I'm tired of everything. I'm tired. I want to go. And I felt bad. Like, I felt so bad. Parents are not supposed to bury their children. Children are not supposed to bury their parents. And the father sat down and started crying. And I remember I said, there is nothing I can do. I went to the nurse's room and I prayed for her. I said, God, tonight is not going to be easy. But I said her name and I told God that there is nothing I can do. It's already like 1 a.m., 2 a.m. There is nothing I can do. I'm putting her into your hands. Give her rest, give her peace, and strengthen her family, strengthen her father. And I told God, me, I'm going to sleep. I'm going to sleep, but in the morning I'm going to find her, like she'll be well rested. And I prayed for her and I said in Jesus' name, amen. Like after that, I remember I laid my bed. I went back to the ward, I moved through it, and I saw most of my patients are resting, except her. So I was like, it's okay, all is well. I went back to the room, laid my bed, and slept. I remember I woke up at 5, and I first thing I did was like, I need to go and check on her. So when I went to check on her, she was sleeping. Her chest was moving, but I needed to make sure that everything is fine. I remember I took vitals, I got a stethoscope, I listened to her chest, and I remember I said, God, thank you. And I walked away. And I remember when I left duty in the morning at 8:30, she was still sleeping. And when I went back on ward to check on her in the evening, because it was in my duty, I just went to to sneak in and like check on her. She was eating, and I just said, "Thank you, God." The long hours are real. The emotional attachment is there. I remember even I lost one. I even cried. But me, at the end of the day, when I see my patients are improving, when I see them go back home, when I see them like come back for reviews and are like happy, they are well, that is what I live for. That is something that I think every medic wants their patient to go through. And I just feel good about it. I feel like God put me in the right profession because caring is something that my mom always said that I had. I remember we used to be young and we would get we had huge trees in our compound, in my grandfather's compound, and there used to be these small birds that used to have nests, and sometimes their babies will fall to the ground and we will get them, take care of them until then we release them. So my mom always said I had this caring nature, and for me, I find satisfaction from that. Like I wouldn't complain. I just feel like I'm in the right profession for me. So after surgery, I went to pediatrics, and pediatrics is like internal medicine. That's what I can say because the only difference is the differences in the dosages because you're dealing with the children and the babies. The other side, you're dealing with grown-up people. But one thing I loved about pediatrics is they're working together as a team. I don't know if that was the case, but when I was there, there were interns, there were staff like midwives, nurses, there were specialists, there were MOs. So it was more of like teamwork, something that I loved in pediatrics. However, there were limited resources. Parents or the attendants had to go and buy most of the things, the cannula, the normal set. Like it's not that almost every day there was a shortage, but most of the time because the government would send the medicine, would send the IV fluid, but this was a regional referral. Everyone from all over the neighboring villages was coming to the regional referral, or they were going to the national referral. And most people didn't have the transport to go to Kampala unless when the referral had sent them there. So these things would get over in a short period of time because of that. So many patients coming in from Lira and also from the neighboring villages. So that's why there is a lot of shortage of resources. And then another thing, of course, the many babies. The room is small and there are so many babies. And right now they were looking at renovation, which is a good thing because the babies are many. The number is overwhelming and the staff, they're still few. And another thing, of course, is the emotional demand, especially in NICU. I used to look at the babies. In NICU, they normally bring babies who are prematures, more less than 1 kg. In babies were like so small, so small. And you would leave them there today. They come back the other day, they told you that the baby passed away at night. So it's hard. Like every time I think about it, I always I always get a heavy heart because these are little human beings that unfortunately do not get a chance to live, which is sad. I try my level best. I think it's one of the reasons why I'm very slow to jobs that are in hospitals because I have a habit of getting attached. I have emotional problems. I can say. I wouldn't say it's a problem also because I'm compassionate. I believe I'm compassionate because I believe I hurt when I see someone else hurting. It has helped me give quality care to people. It has helped me involve myself in the care of these people. I'm not a kind of nurse who keeps quiet when there is a word round, when there are people, when they're discussing about the care of a patient. I'm a kind of person who's going to say, this medicine hasn't worked for my patient. This is not working for my patient. Let us look into these options. I'm not going to tell you like, yeah, yes, no. I believe discussion of the patient's healthcare and progression and improvement is very important, especially if you're working as a team than one person. So some of the valuable lessons I learned this internship is number one, time management. I learned to use my time very, very smartly and wisely. So I have a ward of 40 patients. I'm working day duty because remember nurses have shifts, day, evening, and night. I'm working maybe a day shift and I have 40 patients. How am I going to utilize that time to cater for all my patients? And how am I going to educate also my patient in that time? So I learned very, very well how to use my time and in order to give high quality care to my patients. I know that things might seem like, oh my God, this girl is saying these things are possible. If you're passionate about what you're doing, if you're interested in what you're doing, the problem is here, even if you love something, the system frustrates you and you lose love for it. But I've met passionate doctors, I've met passionate and successful nurses, and that's the reason why I love what I do. And time management is one of the things, not only in my internship or with my patients, but I've also applied it to my life. And I'm very, very intentional about which people I spend my time with. Number two, communication skills. When I talk about communication skills, I'm talking about communications with the families, with the doctors, with the specialists, with the patients, because communication is key in the health facility. You have to communicate what you've given, when you've given it, what the patient is on, what the patient is suffering from. Like medical errors are very, very common. So we have to communicate clearly in order to prevent these mistakes. Number three, I talked about clinical skills. My clinical skills, I believe, have greatly improved. Something about internship is if you're interested, you will learn. No one is going to force you on word. We are above 18 years of age, so no one is going to force you on word. However, I believe my hands-on experience has helped me improve my clinical skills. So in addition to that, I've gained a lot of confidence. I'm not like, oh my God, what am I supposed to do? What am I to do? No, I know what I'm supposed to do. My skills greatly improved this internship, and I'm so grateful for that. I can also talk about adaptability and flexibility. This favored nurses mostly because we had the chance to rotate to almost all wards in the hospital, something the doctors didn't have. I had a chance to go to TB, to HIV, to mental health, to ICU, to NICU, to medical wards, to surgical wards, all of them, to TFC. TFC is a therapeutic field center where we manage all the malnourished children. And this gives you knowledge about all departments. You may not be specialized in them, but you're also not blank. So adaptability in different departments was so important for us, and I'm so grateful that I was able to do that during this internship. Another thing that I learned during this internship is teamwork and collaboration. No one in this medical field should deceive you or tell you that they are a one-man army. It doesn't work like that. So in this internship, I learned so quickly that we have to work as a team. First of all, because of the workload. Secondly, because everyone has their own purpose. A nurse, a doctor, a pharmacist, a lab technician, they all have different purposes. So a doctor will never know what a nurse goes through. A nurse will never know what a pharmacist goes through. A pharmacist will never know what a lab technician goes through. And I always tell people to always stay in their lane. Do not speak like you have the knowledge about something that you're not practically there. Because I have friends who are doctors, I have friends who are nurses, I've got amazing friends who are pharmacists, but I'm not going to pretend like I know what a pharmacist goes through. I can speak better for nurses because I know what they go through. So teamwork and collaboration is very, very important, as everyone has their own function in this health factor. Professionalism. You are going to have issues. You're going to disagree with the surgeon. You're going to disagree with the medical officer. You're going to disagree with your fellow nurses. You're going to disagree with patients, but you're not going to refuse to work on them, and you're not going to refuse to work with them. You're going to put your feelings aside, and you're going to look at the main person in this, and that is the patient. So whatever disagreements you may have, you throw them out of the window, collaborate, and work for the betterment of the patient. The seventh point I'm going to talk about or discuss is stress management. You have to learn to love yourself first. Immediately you're out of that job, immediately you're out of that internship, immediately you're out of that ward, another person is going to come in and replace you. You have to love yourself first. You have to put yourself first. I'm not saying that you have to be selfish, but learn to have your needs first. If you're tired, if you're burned out, ask for 30 minutes. I'm going to be back. Can I go out and have my BT? Can I go out and eat something? I'm going to be back. Can I have this day off? I'm not feeling well. It is okay to ask for help from the staff, from other people, but also you have to take care of your mental and physical health as a person. It starts with you. Do not expect anyone else to start taking care of you when you're not taking care of yourself. So love yourself first. And my last valuable lesson that I've learned during this internship is health education is very, very important. You guys, you do not know the difference it makes when you educate a patient about their condition, like using simple language to break down these complex conditions, and also teaching them the treatment, the health maintenance, and the medications they are on. You have seen young children who have diabetes knowing how to administer the insulin themselves. They know which foods am I supposed to eat and which foods I am supposed to avoid. You meet a patient and they have sickle cell anemia. You tell them, you teach them about the crisis, you teach them the triggers, you teach patients about their conditions, because this empowers them to take an active role in their management. And this eventually improves the health of people. If you know the preventive measures and you know how to go about them, why would you be sick? You'll only be coming to the hospital for reviews, for just checkup, and go back home. So health education is very, very crucial. Thank you for watching. If you found this video informative, don't forget to give it a thumbs up, share it with anyone who may need this information. Until next time, bye-bye.
2, 1, 0.